Here at Tarzana, we are an integrated facility. We provide mental health services, we provide primary care services, detox. So if a client needs to see a psychiatrist or a therapist or is dealing with Hep C or HIV, like we have those resources here. It's sort of like a one-stop facility where it's like, okay, let's get you back on the right path and overcome all those barriers.
Methadone has been around forever. We used to administer it and still do in our detox. We also have our OTP clinic, so we offer the methadone maintenance there. And we've been working with Suboxone maybe about 4 or 5 years now. They have an opiate dependency. We've got the methadone, the Suboxone, the Brixadi, the Sublocade. And if it's alcohol, we have Vivitrol. And Vivitrol is also used for the opiate because we have the pharmacy on site. It's much easier to hold the medication here instead of having to order out, have it come in.
So typically I will first meet a client when they come in to get admitted for the first time, get them from the front lobby, introduce myself to them. When they are inpatient, they are of course here. So if I see them in the cafeteria or in the hallway, and let's say I notice they seem pretty upset, I will be like, hey, come to my office, like what's going on? Specifically with Matt, I want to make sure that the dose is right for them, that they're not having cravings or urges.
Whenever a patient comes to the window, I greet them. I like asking about how their day is, and then I have them sign a form initialing that they received the medication, whether that's methadone or Suboxone, and then see how they respond to it before I let them leave.
If they don't have insurance, we help them enroll in insurance. We start them from there. I'm assessing the patient medically to see what are the patient needs. For opioids, we have 3 options. We are using methadone, Subutex, and microdosing, and we give the option to the patient to choose the one that he feels more comfortable.
Tarzana is like a village. I always tell the clients, you literally have a little dream team. You have your MAT counselor, you have your case manager, you have your residential counselor. Once you're an IOP, you'll have your IOP counselor. So you literally have people that are rooting for you. You're not in this alone.
Our MAP program has started this thing called MNTP program. It's a mobile unit. They get on that bus, go to local communities, and spread the word. So I'm really excited for that.
Tarzana Treatment Centers has really tried to push that envelope in taking full advantage of any opportunity to provide an innovative treatment modality for the community. The goal is to bring, especially services which can be very burdensome for patients, to bring those as close to them as possible. We have several sites that are serving unhoused individuals who are involved in case management services, going to the tiny home villages throughout the San Fernando Valley. We first had to think about what services we wanted to provide. Do we only want to provide medications for opioid use disorder, so methadone, buprenorphine? Do we want to be able to provide the counseling? We want to be able to provide primary care, the physical and assessment with the provider, since each of those would need their own space. The counseling space will be used to conduct intakes. There's 2 accordion doors that close to make that a private area. The bathroom will be primarily used for collecting urine samples for the urine drug screens. That exam space will be for the provider to conduct the physicals and conduct their assessment, has the full-size exam table. This part of the dosing room is where the nurse will be. So when the unit's providing services, the dosing room will be locked. There's a safe in that bottom cabinet. We have the security cameras, a glass divider between the dosing room and then where the patients will come up to receive the medication. So we had to figure out the driving route, we had to figure out the hours. Then we had to think about what's gonna happen if there's an accident. So then we have to have contingency plans. We know how are those patients who would have been dosing with us on that day going to receive that. So we've had plans in place where they can then go and be directed. You know, even if one individual finds services or can start these services that otherwise wouldn't, just because they'd have to come, you know, to our building here in Tarzana, or they would have to meet with their provider in a clinic office that they don't, and they may not feel comfortable for, you know, myriad reasons going into that facility. If we can help even one person because we are going to them, that's a huge barrier that's already gone now.